Okay, good morning. We're here with an international patient of ours from New York. She's 21. She's a really pretty young lady, but she feels like her nose is too big and is distracting. So she wants a rhinoplasty. With her, what we need to do is we're going to need to take down her dorsal hump and smooth that. We want to reduce her tip to make that more defined. We want to narrow her bones to narrow her nose there as well. She's also got some tip asymmetry because of some septal deviation. So, those are the general things we want to correct in the nose, essentially giving her a more delicate and feminine and refined nose. And so we'll go through the maneuvers to make that happen.
I always find it harder to breathe when you stay close to me. It's too much. Trying to save my breath in this moment. The way that you look at me, I can't help myself.
Okay, so we've gotten started here. You can see she had really significant dorsal hump and then a droopy tip. So what we've done is we've opened up the nose through a small incision at the waist of the columella. And then with that we can expose the architecture of the nose, which is the bone and cartilage. So these are what are called the lower lateral cartilages here that make up the tip, and we'll deal with those later. But one of the first maneuvers we've done is we've already dissected out and then freed or chiseled off a piece of bone and cartilage that's responsible for the dorsal hump. So that'll make that straight on the top, and then we'll just sort of fine-tune this down with the rasp to get it really smooth, but that's brought her down quite a bit already, and then we'll do the rest of the work. Okay, so here we've got some of the cartilage pieces we took out. This was the dorsal hump, that's some cartilage and bone. This was some septum, and then some other little pieces. And so I'm just going to kind of design the little grafts we want to make, which will then help with our reconstruction of her nose. So we'll divide this into what we call spreader grafts. We'll do a columella strut, a shield graft, and then use those. Okay, what we're doing now is we're working on the nasal bones, and what we do is we actually create fractures in the nasal bones to move them together. So if they're wide like this, what we want to do is narrow them to change the orientation that makes the nose thinner. You can appreciate here we've done the movement of the bone on her right side, and we can see how this thins out quite a bit. And then this bone hasn't been moved, so it's still flaring outwards. So we'll do this other side to get them both in, and that's going to narrow the top of her nose. And then we'll come down and work on the tip. Okay, so we're moving along here. You can see I'm working in the tip now. I've put in what's called a columellar strut, which is going to help support our tip and provide really a base and help straighten it. And then when we sort of bring the skin back down, we can see this coming along, that our dorsum's nice and straight, the hump's gone, we've got the upper part of our nose nice and narrow, and then our tip, we've gotten good projection here, so we're getting all those relationships set the way we want them, but we're still very full and bulbous here. So now we're going to do the end tip refinement by reducing some of the cartilage that's causing that bulbousness and shaping those so they're a nice, softer triangle with more definition. Okay, so recall when we started, we had, a number of issues with her hump and her width and her bulbous sort of hanging tip to address. And we've done all that. You can see this is just right, when we're finishing, but our dorsum's nice and straight. We've got a nice projected tip with good tip support. We've got a much narrower nose. We've got much better tip definition and rotation. So overall, very nice change for her. We're just gonna put her in a splint and a dressing because we're gonna need this skin now to really shrink wrap down around the form as she heals. So this will make a really nice change for her. Should be a really nice result.